All right, so let's talk all about Mickey buttons and how this baby gets food, how we do it, what is a Mickey, what is the key, what's the Mick, what's the key, we'll talk about that. We'll talk about how to do the whole process. We're gonna talk about how to clean it, how to assess it, all the things. Okay, so sometimes babies can't eat using their mouth. So they'll have maybe an NG tube for a while, but this is more of a short-term solution versus a long-term solution. So they will have a hole, a gastrostomy hole, put right into their stomach organ. So it's going to be located on the left abdomen, right over the stomach. And so when we're looking at this, you're never going to see this just wide open. So you're going to see it when it has its key in it. I'm going to talk about the key. So this is the Mick. So this is the Mick of the Mickey. If you ever hear it called Mickey, it's not like Mickey Mouse. It's the Mick and the key. And I'm going to teach you how to put them together and how to use it. But what you'll see is that the Mick has a balloon, and the balloon's job is to keep it in here, because if we just put the in here, okay, in his gastrostomy, if I just put this in, it can easily fall out, get pulled out, all the things. So we need to be able to inflate the balloon. The balloon is here. You can see the BAL. The balloon inflation is here. So we are going to put it in. We're going to fill this balloon so you can see how then it stays. Okay, now you see that the Mick doesn't come out because the balloon is inflated. And when kiddos pull them out when their balloon is inflated, they can cause themselves a lot of injury. So we want to make sure that this stays in and stays protected, especially if you have a grabby kiddo. So when you see a kiddo with a Mick, you're going to see them just like this. It's going to be obviously a little more flush with the skin because this mannequin has a little bit of an anatomical difficulty at the moment, but your Mick should stay pretty flush with your skin, and then you're going to have skin around it to assess. What we want to see is that the skin is clean and dry, intact. It's not excoriated. It's not red. It's not bleeding. It doesn't look infected. There's no pus or anything coming from that area. So we want to see nice, healthy skin around this Mickey. Sometimes, and this is all parent preference and what they normally do at home, sometimes they will use gauze and they'll cut it like a split gauze, and they will let that gauze sit around the Mick just like that. I probably would have cut that a little less so it would stay, but that is a sign of a nice clean Mickey with a bandage around it, and that just protects the skin from the plastic rubbing on it. You might also see that parents buy covers for these. They're really cute. They come on Etsy. They're like little elastic covers. It's kind of an out of sight, out of mind. You may also see kids with adaptive clothing that actually have clothing that have special holes just for the Mick for feed and med administration, which is really cool. I want to bring your attention to the Mick itself. So see, there's a little black dash line here. Okay, this is what the Mick looks like when it's closed, has a little plug on it. This is what it looks like when it's open. So there's a little dash line, and you'll understand what that dash is when you see the key. So the key also has a black dash mark on it, and it gives you a direction in which to turn to lock it. Locking means that it's not going to pop out. This is really important when we're infusing medication or feeds or really anything that we're putting in there. We want to make sure that it's locked and it's not going to come out, or else their bed is going to be soaked with whatever we were infusing and nothing is going to stay in the baby. So when you go to put the key in, you're gonna line up the dash with the dash, inserting in here, making sure it goes the whole way down, okay? Then we're gonna follow the direction of the arrow. So the arrow tells me to turn it this way to lock it. And you should feel a little click or a little sync. With these practice ones, you might not because they've been through a lot, but at the hospital, you definitely should. And now you can see that I've turned it and now my dashes are not lined up. And if I go to pull this out, it should not come out. And that's what we want to see. We want to see that it's locked and nothing is going to flow into our bed rather than into our baby's stomach. And we can use this GTube or Mickey for anything that baby would drink otherwise. So oral medications, oral fluids, formula, all the things we can flow right through the GTube, and then any IV medications would be going into their veins, obviously. The next important step that I need you to really practice and remember is the clamp on the key. So the clamp on the key is just one of those little like clicky clamps. I don't really know what the technical term of it is, but it just clicks down and you know. And I like to have my thumb have the control over it because I can flick it open and I can close it. But this is going to come very in handy when we're infusing medications, because when we infuse medications into here, if you don't have the clamp closed, when you have this open, you have a path of least resistance for anything in this baby's belly to come directly out at you or in the bed. So you're going to, whenever you have this open, it's a clamp closed, then you put your syringe in here to infuse, and then once you're ready to push the syringe, you open the clamp up, you push your medicine in, then you come down and clamp again, and you just repeat that process over and over and over again. Now, the ones that are in the hospitals now, I don't have the full set yet of connectors, but what they are you're gonna see they're purple and they have more of a lure lock connection to them. So I don't know, maybe, oh, I think this one actually has it. Let's see, take a look. This is a feed bag. Go over this in a little bit, but I just want to show you how the connection, what you're going to see at the hospital. So it's a twisty connection, just really, really nice. So that should be how all of your syringes are too. They should be twist locks to make it easier for you to administer medication and food. Okay, let's talk about the feed bag. So if your baby's on feeds or your kiddo's on feeds, because anybody can be on feeds, this is the bag that you're going to use. This is a 24-hour bag, and you have to throw it out every 24 hours and label it and everything. But you guys should see that they're good. They typically change them over at nighttime, but you just want to check and see the label on it has a good date and time within a 24-hour time frame. The feed gets poured in here. This is the cap for it. I want you to see that the cap kind of snaps in there, but from above you, that cap looks just like it's open. Take it from a nurse that accidentally poured a whole thing of feed into the cap. That created a huge waterfall mess for myself. Always make sure your cap is open and before you're ready to pour your feed into here. And the feed would be found in the orders on the chart. And then this is the cartridge that gets plugged into the feeding pump, which you'll learn about at clinical. And then this is going to be the connection you get from the end of the bag, which you will prime through the kangaroo pump. and then you'll connect it to the patient and it will be ready to flow in and at the prescribed rate and amount. You have to double check all of those things in the chart. Let's talk about Mickey Care or GTube Care in general. So you're gonna get 2 cups, 2 medicine cups, Johnson & Johnson baby soap, some cotton tip applicators, and some sterile water. What I do, and this is just me and how I've learned how to do it, I do a soapy water cup and a clean water cup. So put a little soap in here, pour some sterile water. You can stir it around with a stick, and then your clean sterile water in here. This is not a sterile process. It's just easy to use sterile water. So then once you have your soapy water, then you are going to take your cotton tip applicator, get it nice soapy watered, and then your baby will be in bed. Get the light turned back on. All right, so your baby will be in bed. You have your soapy applicator. You're just going to take your soapy applicator and you are going to scrub all around that site. You may have to scrub a little more hard if you have some, just dry gunk or whatever is in there. So you're just going to clean that really, really good. And then you're going to get rid of that one. And then you're going to take another one, get your clean water. You're going to go around and kind of clean up the soap. And then you can also just take another dry set and just go through and dry it. Or you can take those really nice, like dry towelettes. They're like the little disposable washcloths that we use for a lot of like diaper changes and things. And you can just go through and dry it really good. We don't want to leave any moisture behind so we don't have any skin breakdown. And then you put a new split gauze on and your GTube Care is done, except they usually like to turn the Mickey just so the Mickey doesn't wear a little like hole in the area. Just kind of turn it like 90 degrees, just kind of turn around, and then your GTube Care is done. Okay, now that we've talked all about the Mick and the key and all the feeding bag and all the things feeding that are kind of abnormal. We didn't talk about bottle feeding or anything like that, but we can probably learned about that in OB, to be honest. So all we talk about the GTube feeding, all things, I just want you to practice. I want you to practice putting the key in and out. You can practice taking air out and putting air back into the Mick. You can kind of see what that looks like. I want you to practice opening and closing your clamp and connecting syringes to your key so you just feel more comfortable when you get to clinical. Remember, this is all about decreasing anxiety and stress surrounding taking care of our pediatric population and their families. So by practicing here in the lab, you'll feel so much more comfortable when you get to the hospital.